Pharynx, a muscular passageway connecting the nose, mouth, and esophagus, essential for swallowing and breathing. It directs food to the esophagus and air to the lungs. Conditions like infections, pharyngitis, or cancer can affect it, sometimes causing pain, difficulty swallowing, or voice changes. Appendectomy, a surgical procedure to remove the appendix, typically due to appendicitis, which causes inflammation and severe pain. It is usually performed as an emergency surgery to prevent rupture, which can lead to peritonitis, a life-threatening infection. Recovery is generally quick with minimal complications. Pancreas, a gland behind the stomach that produces digestive enzymes and hormones like insulin and glucagon. It aids digestion and regulates blood sugar. Conditions like pancreatitis, diabetes, and pancreatic cancer can severely affect its function, leading to digestive issues or metabolic disorders. Ileostomy, a surgical procedure that creates an opening, stoma, in the abdominal wall to divert waste from the small intestine, bypassing the colon. It is often performed for conditions like Crohn's disease, ulcerative colitis, or bowel obstruction, requiring an external pouch to collect waste. Jaundice, a condition where the skin and eyes turn yellow due to excess bilirubin in the blood, often caused by liver disease, bile duct obstruction, or hemolysis. It can indicate underlying health issues such as hepatitis, cirrhosis, or gallstones and requires medical evaluation. Gallstones, solid particles that form in the gallbladder from cholesterol, bile salts, or calcium. They can block bile flow, causing pain, nausea, and digestive issues. Treatments include dietary changes, medication, or surgical removal, cholecystectomy, if symptoms become severe or complications arise. Reflux, a condition where stomach acid flows back into the esophagus, causing heartburn, irritation, or damage. It is commonly associated with gastroesophageal reflux disease, GERD. Triggers include fatty foods, caffeine, and obesity. Treatment includes dietary changes, medications, or, in severe cases, surgery. Ileum, the final section of the small intestine, responsible for absorbing nutrients, especially vitamin B12 and bile salts. It connects to the large intestine at the cecum. Conditions like Crohn's disease, infections, or blockages can affect its function, leading to digestive and absorption issues. Polyposis, a condition characterized by multiple polyps, often in the colon or digestive tract. While usually benign, some polyps can become cancerous over time. Regular screenings, like colonoscopies, help detect and remove them early to reduce the risk of colorectal cancer. Duodenum, the first section of the small intestine connecting the stomach to the jejunum. It receives chyme from the stomach, bile from the liver, and enzymes from the pancreas to aid digestion. Conditions like ulcers, blockages, or infections can affect its function and nutrient absorption. Cirrhosis, a progressive liver disease where healthy liver tissue is replaced by scar tissue, impairing liver function. Causes include chronic alcohol consumption and viral hepatitis. Symptoms may include fatigue, jaundice, and swelling in the legs. Laparoscopic surgery, a minimally invasive surgical technique involving small incisions and the use of a laparoscope, a thin, flexible instrument with a camera, to operate inside the abdomen. Benefits include reduced pain, shorter recovery time, and smaller scars. Hemoccult test, a diagnostic tool used to detect hidden, occult blood in the stool, which can be indicative of colorectal conditions such as polyps, hemorrhoids, or cancer. The test involves applying stool samples to special cards that react with blood. Hepatitis, inflammation of the liver, commonly caused by viral infections, hepatitis A, B, C, D, E, excessive alcohol consumption, or certain medications. Symptoms may include jaundice, fatigue, and abdominal pain. Chronic hepatitis can lead to cirrhosis or liver cancer. Crohn's disease, a type of inflammatory bowel disease, IBD, that causes inflammation of the digestive tract, leading to symptoms like abdominal pain, diarrhea, weight loss, and fatigue. The exact cause is unknown, but it involves an abnormal immune response. Gastrointestinal, pertaining to the stomach and intestines. The gastrointestinal GI tract includes organs such as the esophagus, stomach, small intestine, and large intestine, responsible for digestion and absorption of nutrients, as well as elimination of waste. GERD, gastroesophageal reflux disease, a chronic digestive condition where stomach acid or bile irritates the food pipe lining, causing symptoms like heartburn, regurgitation, and chest pain. Lifestyle changes and medications are common treatments. Cholelithiasis, the formation of gallstones, solid particles that develop in the gallbladder from cholesterol, bile salts, or calcium. Gallstones can block bile ducts, leading to pain, infection, or other complications. Treatment may involve medication or surgery